Without further ado, let's get started with the first session, where you will discover the softness effect of Genefill Contour can provide through a live demonstration of hands by Dr. Fabio Fantozzi.
Good afternoon, and we started the session with the infiltration with the hyaluronic acid with Genefill for the hands. And so I stay with this lovely lady, the name is Veronica, and we started the session, and only I show the first step is to mark the hands. And in this close-up, I mark the lateral part of the infiltration, both. And here we can see the line of the tendons, and we can see the little superficial veins. Now, from this point, I will enter with a cannula, and I will inject the filler on the dorsum. First step is the infiltration. Is very easy. Only one point here. We make the infiltration in the point where I got the entrance. Second, I take a needle, is a pink needle, only just to enter the cannula. Okay. And we say this cannula is 18 gauge. I enter. I take the syringe, is a Genefill Contour. I put inside, and I started infiltration. Okay. Here you can see. Okay. And I go to the finger, and I release. 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 The same, and the same. Okay. We pass another points that need. Here. Do you feel pain? No. Okay.
No, not at all.
In this part, the anesthesia is only in the point of entrance. In the dorsum, there isn't anesthesia. And so we can see that without anesthesia, we can do it. It's no problem. Now, we stop a little bit. We close the hands very strong. Close the hands strong. And you massage. That is very important to distribution of the hyaluronic acid on the dorsum. We wait, okay, and we watch again. And so we see that there is another point that need. And so we come back with the cannula, okay, and then we release a little bit infiltration of hyaluronic acid. Here, a little bit, here, and here. Okay, and we finish. Now, repeat, close the hands, massage. Okay, and we stop. And so, a little bit here, more, only to complete. The same, enter. Go a little bit. Okay. And close the hands. Perfect. And we finish. Okay. Here. You put here. Okay. And we can pass in other hands. In the other hands is the same. Okay. It's here. The same. I have the point. the lateral limit, and I start with the infiltration. Okay, here. I take the anesthesia. Before of the infiltration, I put, the asepsia of the hands. That is a really important point. That to be sure that everything, that this part is very important to clean. If you want, with the soap before, and chlorhexidine after. And we start with infiltration. It's here, the same. Okay. You see, here. And we go. Okay. Finish.
Can you ask him to show the both hands?
Yes, Dr. Fantozzi, could we see both hands so as to see the difference between them now?
Okay, yes. Please. Okay, here. 1 second, because the camera. Okay.
And
Can we take both the hands?
Okay. We can see the difference. It's amazing.
Okay. It's okay? Okay. But now, but after, I will send the photo before and after the treatment to look, exactly. Okay, here you put the position. Okay. Yes. And we start. And we go to the finger and we release. That is very easy. Okay.
So you use only one entry point, and can we ask how many mLs have you injected so far?
Normally around 10, 15, 10, one syringe or two syringe. Depends, the problem that the hands that you have. Normally is one syringe, maybe two. Depends. If you need more, is around 15, 20, 10, depends, but this is the amount. One syringe or two syringe of 10 cc.
Perfect.
Okay.
So I understand that the local anesthesia is only done in the entry point?
Yes, only in the point of entrance.
But the patient is comfortable?
Yes, the patient is here, and I think that is very comfortable. It's here, and so it's no escape, and so is all the anesthesia in the point is working. And so it's here and not cry, it's very relaxed. Because I think if you put in the dorsum the anesthesia, you make, with a hyaluronic acid, it's not good combination at this moment. In the dorsum, the skin is very thin, and so it's much better, don't use if you can. But if the patient doesn't, resist, okay, you can put a little bit here points of anesthesia only to be comfortable for the patient. Normally, 90% of the patient doesn't, is okay only in the point of entrance. Okay, here you look.
Yes, it is incredible.
Okay, and if you need, we can, after, is always good, massage, and after, you come back where maybe there is a little depression, you put again. And you close the hands, okay, you massage. Maybe 2-3 times, only to check. Okay, you go, okay. No, it's working very well. It's very easy. The amount, not so much in the reality is, and we can put a little bit there to be sure about the result. And we finish. This procedure is with 10 minutes, 15 minutes. You can make a rejuvenation of the hands. You can repeat one time and here, and the patient, maybe the day after, is normal that you have 48 hours that you have edema. That is normal. If you want, you can use some no steroid inflammatory drugs that is working very well, or arnica, something natural inflammatory. That's okay.
Perfect.
Okay.